healthcare sector is such an outsized contributor to waste and to greenhouse gases. Ophthalmology itself is an outsized contributor within healthcare.
Globally, healthcare is responsible for nearly 5% of carbon emissions, number 2 source of landfill behind the food industry in the US. 71% of this is from the manufacture, use, and disposal of supplies. And us specifically, we have one of the largest carbon footprints, sheerly from the volume of cataract surgery and intravitreal injections.
The Academy is leading out on a number of fronts, including education. Between their publications and online resources, Academy members can access information and ideas and find ways that they can get involved. Additionally, all residents are able to read a new chapter in the basic principles of ophthalmic surgery, where they can understand how we can produce less waste through our surgeries. Advocacy is another important priority for the Academy. Between the work that we do at Mid-Year Forum with our young ophthalmologists, all the way to work in Washington to draft position statements with groups like iSustain or other partner societies. Looking to the future, the Academy is learning to understand how we can hold meetings in a way that's more sustainable in the long term.
We're looking at the whole picture of carbon footprint, so all of the stuff that we use, you'll notice that the meeting bags are no longer available. Printed things are no longer available, they're usually online now. The ID badges that have the logos printed every year, but then we can't use it the following year. And so now we're going to more generic badges so that they can be reused, excess can be reused the following year. So small things like that add up.
Decreasing your footprint and your impact on the planet can start within your own practice. In general, having a focus on not just the provision of care and the cost of that care, but also the impact on the planet as we provide that care. To learn more about what you can do, go to aao.org/sustainability.
Please welcome the chair of the Academy's Sustainability Committee, Dr. Jeff Petty.
Good day and welcome. It's an honor to have our studio audience here with us, as well as the millions of viewers throughout the world. I'm your host, Jeff Petty. This season, we've seen the best of humanity as our contestants have competed. Welcome. Thank you. Thank you. It is my pleasure to introduce our finalists and contestants. Starting at my right, Dr. Aki Garg. She is an associate professor at Columbia University and a glaucoma specialist. She's also passionate and knows as much about the literature of sustainability as anyone I know. Next, we have Dr. Scilla Ball. She is a cornea specialist, a global ophthalmologist, and someone who has been passionate about sustainability and global ophthalmology her entire life. And finally, last but not least, Dr. Nathan Scott. He is the head of oncology at University of California, San Diego, and also someone who knows how to get things done in this space and in this world. So I've got your questions right here. Thank you for submitting them. Our first question that I want to ask is, who was the worst contestant and why was it Naresh Mandava? But we're going to start with, how did sustainability in the OR become a passion for you? Aki.
Thank you so much for this opportunity to talk about this topic. But audience, keep in mind, I'm stuck on Sustainability Island, so do vote for me at the end of this. I will say, this passion began as I transitioned from OR to OR. Going from medical school to residency to fellowship to attending jobs, I was exposed to writing ORs. And all of the ORs had very, very strict rules, but they were all totally different. For instance, some ORs didn't allow you to allow the patients to take home the drop of moxifloxacin that had just gone in their eye at the end of cataract surgery. All of that entire bottle had to be thrown away once we'd used one drop. Whereas other ORs allowed patients to take home the drops. Some ORs made you use a drape that went from the head all the way down to the patient's toes, whereas other ORs just allowed you to use a small drape. So I saw, as I went to all these different places and talked to people at different institutions, that the lack of standardization really meant that there was no evidence for our practices. And these were just empirical practices that we were doing based on maybe what the regulators told us to do. So taking this information, I started to talk to some of my mentors, and I was lucky to have Alan Robin and David Chang as these mentors who have really done a lifetime's work in this area. And I got more involved and more interested, read the literature, and got very excited about this topic.
Thank you, everyone. Round of applause, please. Nathan, let's go same question for you. How did sustainability become a passion for you?
Well, it's kind of funny. Sustainability really wasn't on the forefront of my mind when I was training. I definitely wish that I was observant enough to recognize how much waste we have in our clinics and ORs, or I was savvy enough to see how inefficient our medical practices really are. But instead, it was more about curiosity. So I was sort of looking for a way to use my policy degree in ophthalmology, and I had a mentor who recommended that I apply to a fellowship with the National Medical Association on climate change and health equity. And when I applied, they kind of said, oh, we were really hoping to have a woman for this spot, but we didn't actually have any more applicants, so welcome aboard. I was like, okay, this is gonna be a lot of fun. And through this program, I sort of learned really about how our vulnerable populations are contributing the least to greenhouse gases and climate change, and unfortunately are affected the most. And these are communities where I grew up, where I come from, and through asthma exacerbations, COPD hospitalizations, etc. These people are affected the most by our waste in our hospitals and our carbon emissions that we sort of have throughout our medical systems. And you find out very quickly that ophthalmology, given how procedurally based we are, contribute a really large chunk of the problem. So it goes without saying, as physicians, we're supposed to be taking care of patients, and instead, in many ways, we are making their health worse. So for me, starting to engage in sustainability really was a social justice effort, trying to help vulnerable populations, communities that I came from.
Thank you. Of note, I similarly got this job because no one else would wear this jacket. Scylla, how did sustainability become a passion for you?
Thank you, Jeff. I'm very excited to be a final contestant. What many people don't know is that my first word was actually sustainability. So I was interested at a very young age, but all jokes aside, I went to elementary school in the 90s, and if you went to elementary school in the 80s and the 90s, recycling was somehow ingrained into our DNA at that point. So I remember I would come home to my two immigrant parents and I would say, we must recycle. And they just looked at me like, what is happening?
The nature of cataract surgery. It's a relatively clean surgery. If we nick the conjunctiva, we have one drop of blood loss in our surgery, and other than that, it's mostly water and maybe some aqueous. Hopefully no vitreous. So it's a generally very clean surgery, and we're doing so much of it. So we need to think about how big our drapes need to be. Do we really need to cover people's toes during surgery? So that's kind of, I think, the beginnings of in our whole conceptualization of sustainability in ophthalmology. Super high volume, clean surgery. Do we need to go to these drastic lengths to clean everything, drape everything, throw away all the bottles of pharmaceuticals after we use just one drop?
Would you mind, just for the sake of time, would you comment on iSustain and the Academy's partnership there?
Absolutely. So, there's growing interest and concern from ophthalmologists about the environmental impact of healthcare, and obviously that's why we're talking about this at this meeting. About 4 years ago, 3 ophthalmology societies from isustain.org. This is a website and a coalition, really, of people interested in promoting sustainable ophthalmic care. We'll provide a QR code for this later on, but if you go on this website, you'll see numerous resources that are available to show you sustainability in the operating room, in the clinic, lessons learned from low-income countries, and there's really a wealth of information there. iSustain now includes over 40 member societies from all over the world, includes industry leaders, ophthalmologists, physicians from other specialties who have really come together to drive this forward.
Thank you. Scylla, you've spent a lot of training living throughout the world in your ophthalmology training, a global ophthalmology fellowship, spending time in several countries. What sustainability insight can you share from your global partners?
Thanks, Jeff. So when I think about sustainability in global ophthalmology and just in general, I like to think back to the 5 R's of sustainability, and many of you have probably heard these, but I'll repeat them. We have research, reduce, recycle, reuse, and then rethink. So what does the research show? We are so lucky because there is a lot of research out there now that shows us that we can make an impact. For example, there's one study that showed that a phaco-cataract surgery in the UK generates the carbon emission equivalent of driving your car about 310 miles, okay? The same phaco-cataract surgery in Aravind in India generates about 23 miles driven. Think about that. That is a 13-fold difference in carbon emissions. And I saw this firsthand, Jeff. I saw this firsthand. I worked at Tilganga Eye Center, which is essentially the Aravind equivalent in Nepal. We were reusing everything. So let me paint a picture. Patients come in, they get tested for communicable diseases like hepatitis and HIV, and then they come for their surgery. We reuse our gloves for 10 cases, okay? Between cases, we of course aggressively, if you're me, wash our hands with spirits. All of our instruments are reused for the entirety of the day. They, again, are washed with spirits. Our gowns are cloth, our drapes are cloth. Every single part of the system is reusable. And the way they're able to accomplish this is that they have systems in place that ensure equivalent outcomes to what we have here. So equivalent endophthalmitis rates, equivalent surgical outcomes. So how can we incorporate those principles into our practices here?
It's really well said. You know, during the COVID-19 pandemic, at Aravind they began to implement more what we would consider stringent standards as far as not reusing gloves. And by reusing a glove, you sterilize it with absolute alcohol between cases. And then they needed to begin only having one patient in the operating theater, having a gown on the patient. And over the, of course, thousands of cases that they do, and in a year they'll do around 800,000 procedures and surgeries, they did not see a change in the infection rates or the outcome. So we know that there's more we can do. We also recognize we can't operate in the way that Aravind does, but those are the lessons. Nathan, I'm feeling like you're getting kicked off. I don't know. This is tough. Let's see if you can bring it. What is a major barrier to starting a sustainability initiative, and how might one overcome such a barrier?
So barriers, you're gonna run into a lot of barriers. I think one way to put it is I'm watching a Netflix series called The Starting Five. It's about some basketball players. And if you're a basketball fan, you know who Jason Tatum is. He's an all-star on the Boston Celtics. And they're interviewing him in this docuseries, and they're asking about how hard his job is compared to other jobs. And he says, you know, there's no other job in the world where there is someone who is trying to actively stop you from being good at your job. There is someone there impeding your success on purpose. I said, Jason, well, as I'm watching this, I'm thinking to myself, Jason, you've never been in academic medicine, because that's very much what it feels like half the time, especially when you're thinking about sustainability efforts and mitigating change. I'm only kidding. Most people, most administrative systems are completely on board with reducing costs, reducing waste, and helping the environment. This is about patients. It's really just about that inertia of trying to get change to not only happen, but then to be sustainable and to actually be there and sort of make our incremental changes as we move forward.